The family of a psychiatric patient at Helen Joseph Hospital say the Johannesburg facility is filthy and should be closed to patients. It has also complained about the lack of care and unacceptable staff attitude. The hospital says it's under pressure with the number of psychiatric patients coming in. Around this time last year, the health facility made headlines over psychiatric patients sleeping in the emergency room on a corridor. Now, Newzroom Afrika's Zikhona Tshona takes a look.
Videos of psychiatric patients at Helen Joseph Hospital. Conditions here don't look good at all, with patients sleeping in the emergency ward. One family says their relative waited for hours before they could get help and spent nearly a week in the emergency area.
On my side, the first person is here. If really health inspector, they have to close that hospital.
The woman describes what they witnessed upon one of their visits.
The manner of approach is not right.
The family is furious, but also fears victimization.
First thing, that hospital is dirty. I don't know whether they were more clean or somebody was lying there.
They also complain that their relative was not fed. And this is the response they got when they asked about bathing. Following Newzroom Afrika's intervention, the hospital has reached out to the family. It says the patient only went without food for 1 day as he was rejecting it, not that he was denied.
It pains me to have heard what the type of experiences that they've gone through. If we could start with the issue of staff attitude. It has been a bit of a challenge, and it's something really that we're now focusing on as a hospital.
The hospital says it's currently facing a challenge of not being able to accommodate all psychiatric patients upon arrival, and it acknowledges that the emergency area is not an area where patients are supposed to sleep, as it is busy.
Now we have about 12 patients who are waiting for a bed in the ward that we're continuously managing in our casualty setup. So the pressure of acute beds is a real scenario, and I know from what I understand with head office, they are having plans in place to really address the issue of acute beds.
The hospital has also given a guarantee that the patient in question will not be victimized for his family speaking out about their experience. And it's encouraging families to not fear raising their voices, saying it's the only way services will be improved. For Newzroom Afrika on Channel 405, I'm Zikhona Tshona in Johannesburg.